Welcome. This is the Heart Hanks 2017 Annual Enrollment Short Webinar Presentation. My name is Amy Moreno. I'm the Benefits Specialist for Heart Hanks. I created this presentation because I wanted to have something available for those employees who are currently enrolled in coverage, who know they want to enroll in coverage for next year, and are only interested in finding out exactly what the changes are and exactly what they need to do to enroll. If you've received the postcard in the mail or you've checked out any of the annual enrollment information posted on the HR Zone, you will have seen that very little is changing for next year. This presentation should last no more than 15 minutes, and if you have any additional questions, there is a longer version available on the HR Zone, or you may contact the HR Zone Monday through Friday during normal business hours. This year will be an active enrollment. That does mean that you must go into the HR Zone and make your benefit selections for 2017. Your window of opportunity to make those elections will be October 24th through November 11th. All elections must be made in the online HR Zone benefits enrollment portal by end of day on November 11th. If you have not made your elections by end of day, you will not have coverage for 2017. Just a reminder, employees are eligible to enroll if you're a full-time active employee who works 30 hours or more a week. The elections that you make during this annual enrollment period will be effective January 1 of 2017. If you've waived coverage in the past, this is your one opportunity during the year to elect your coverage, and you will not be able to make any changes to your coverages unless you have a qualifying life event. And that's is as of November 11th. This is your 3-week window to make those 2017 elections. Once the portal closes, the end of day on November 11th, everything is locked in and changes cannot be made for the 2017 plan year. If you have one of the life events listed there, birth or adoption of a child, marriage or divorce, dependent loss of eligibility, maybe a change in your spouse's employment, so you do have a 31-day window in which you can make changes to your benefits, but it's very important that you let us know within that first 31-day window of when those life events occur. So an active enrollment, like we've just talked about, means that you have to go in and make elections for the next plan year. Things that will not roll over for 2017 are going to be your tobacco cessation and your working spouse surcharges. Those will be the first questions you are asked when you go online to enroll. Your medical, dental, and vision elections will need to be made again, as well as your elections for your medical flexible spending account, a healthcare savings account if you're enrolled in a high deductible plan, or a dependent care flexible spending account. Big news for this year is that all contributions made by the employee into your plans are remaining the same as they are for 2016. So that means what comes out of your paycheck now, if you elect the same plan, will remain the same. We had a really great year for our plan, and we are excited to be able to go into 2017 being able to charge the same rates that we've been charging for 2016. Just a quick reminder, Heart Hanks will continue to offer the 3 medical plans that we've been offering for many years now. We have an EPO plan, a PPO plan, and the high deductible plan, all through Blue Cross Blue Shield of Texas. We will also have the same carriers for our dental plans, Delta Dental, Cigna, and IMED for our vision care. There are no plan design changes to any of our plans, medical, dental, or vision. We will continue to make contributions into a healthcare savings account. If you have elected the high deductible plan and have gone online and opened your healthcare savings account. And we will be adding telemedicine to our medical plan this year. We're very excited. We'll talk about that more in just a moment, but anyone enrolled in Blue Cross Blue Shield of Texas will receive a new ID card for 2017, and it will have the telemedicine provider, MD Live. Their information will be on that card. That does mean if your card's a little late getting to you, don't worry about it. Your member ID number is not changing. So that means you could go on January 1st, January 2nd to the doctor, take your current card with you, and you will have no issues accessing service. The only difference is you won't have that one phone number listed on the card. A few more details on telemedicine. The provider is ND Live. They are contracted with Blue Cross Blue Shield of Texas, so you do have to be enrolled in our medical plan to have access to the telemedicine. It's a $40 consultation fee. That is less than both our co-payments for the primary care physicians as well as urgent care co-pays and your ER costs. So this is a great 24/7 service that you can access via app, online video, or telephone, and they can help diagnose and offer prescriptions for various, mostly general and common health issues, allergies, respiratory infections, ear infections, and more. And I know especially for people with little kids, ear infections seem to be one of those things that pop up at, 10 o'clock on a Saturday. Instead of paying that $50 urgent care fee, getting out of the house late at night, having to go into urgent care or try to make it a doctor appointment with your doctor, just call MD Live. They can help you with that over the phone, and you can stay in your pajamas while you do it. So I think this will be a really great service that we're getting to add to our medical coverage, and we're really excited to be starting this in 2017. A couple other plans with changes. Our flexible spending accounts will have one noticeable change for 2017, and that is that we will no longer have the 2.5 month grace period at the end of the plan year to incur expenses. So this won't affect anyone who has a 2016 flexible spending account. They'll still have until the middle of March of 2017 to use up those funds and incur expenses. But if you elect a plan for 2017, all funds must be incurred by the end of December of 2017. You'll still have until March 31st to maybe you find a receipt for a doctor's visit back in October. You want to go in and submit that and get reimbursed. That's perfectly fine, but any receipts that you submit must be for charges incurred in the 2017 plan year. So it's nothing that affects you right away, but when you are making your 2017 elections, just keep in mind that you are losing pretty much 2 months that you have to incur expenses and set aside accordingly. Employees, though, will be able to set aside up to $2,550 in pre-tax dollars for those qualified healthcare expenses. You'll still have your debit card. Check the expiration date. Those cards are good for 3 years. So if your card does not expire in December of 2016, hang on to it. You'll just keep using it for next year. We still will offer that limited use flexible spending account that's designed to complement a healthcare savings account for those employees enrolled in a high deductible plan. I will say really there is no reason to enroll in this plan unless you have completely maxed out your healthcare savings account contributions. There's very little this plan can do for you unless you've done that. So really think about it. If you're on the high deductible plan and you think you want to contribute to a limited use, I would put all that money towards a healthcare savings account first. That money is going to keep rolling over year after year, and you won't have to worry about use or lose it dollars. And then, of course, we'll still offer our dependent care flexible spending account. You can put aside up to $5,000 per family for eligible child care and elder care expenses. And this is daycare, after-school care, some day camps, maybe adult daycare during the day if you have a dependent, an adult that's dependent on you. This is the time of year, though, you need to have a quick conversation with your spouse and find out who is contributing to the dependent care account. Every year I get 1 or 2 people that come find me mid-year and say, my spouse and I both put $5,000 towards the plan. At that point, it's no longer any of Hart Hanks' business. It's between you and the IRS, and that you'll need to deal with them for that issue. So have that conversation now, decide whose company you're going to do the dependent care for, and have that decided before the end of annual enrollment. You don't want to get stuck owing the IRS some money. And then just a very quick reminder of your life and disability benefits. I say very quick because these are rolling over. There is nothing you need to do for your basic life, your basic AD&D, and then any voluntary life and AD&D coverages you may have purchased. Those will carry over for 2017. There is going to be a simple review button at the end just to say, yep, I looked at what I had, I'm good, let's keep going with it. If you do want to make changes to that voluntary life coverage, you want to purchase some additional life insurance for yourself or your family, some additional accidental death and dismemberment coverage, you can definitely do that during this time. The system will allow you to make those changes, but you will need to go through the underwriting policy for any additional life insurance. So you will be asked to complete what I call the NOSI form. It's the Statement of Health form through Cigna. That form goes back to Cigna, and then they will decide if they will grant you that coverage. So we'll have to wait sometimes up to 10 weeks for them to get back with us with a decision. And then, of course, you have basic long-term disability through Hart Hanks. Company paid are automatically rolled over. So how do we enroll? Like we did last year. If you were here last year or if you've been a new hire, you know that all you need to do is go to the HR zone, hr.harthanks.com, go to the home drop-down menu, select My Benefits, and you're going to be taken to first the communications portal. And this is a really, really great website. It's a great resource that people are skipping. So I'm going to give you a couple reasons to check out this site. First of all, if you go up to the benefit documents, and there's a drop down and there's an option that says open enrollment information. That's all of our plan summaries. So maybe you are thinking of making a change this year. Maybe you finally want to take that leap onto a high deductible plan, or you've been paying for the PPO plan and you realize, you know what, this may not be worth it. All my doctors are in network. Let me take a look at that EPO plan. Come here. Those documents are right there. You can pull them, look at the differences, and make your decisions. Also, we have a link to our annual enrollment guide. It's right on the front page when you come to this, this portal. Easy to download, pull it, and just keep it on hand during the year. You never know when a benefit question may come up. That guide is a great resource to have just at your desk all year. But once you've made your decisions, you know what you want to do, you'll hit Enroll Now, and you'll be taken over to the benefits enrollment portal. There'll be a button that says Get Started. You're going to click on that and just follow the directions. You're going to start with your tobacco and your spousal surcharge questions. You'll review your dependents, add anyone that you need to add to coverage for next year. There is a page that will ask you some health questions. You are not obligated to answer those. The system has some tools that can help you compare plans and look at what the cost would be if you were to choose the various plans. And by answering those health questions, it kind of gives an idea of what your spending might be for next year. I can't see your answers. No one at Harthanks can see your answers. They're simply to help this tool better formulate an estimate for you, but you are under no obligation to answer those questions. You can put, I do not wish to say, and keep moving on. No, it won't matter at all. Once you're done, you're going to have a big screen that says congratulations. That's how you know that you're done. I recommend pulling your benefit summary as soon as you are complete. Print that out, keep it with you, and look at your first paycheck in January. Make sure it all adds up, that everything carried over. So that's the enrollment process. It's really quick and simple. You should be done in no more than 10, maybe 15 minutes at the most. And some of you, I saw you enroll last year, you were super fast and got through it like pros. So I think this is going to be an easy process for most employees. But if you have any questions, always call the HR zone. Like I said, Monday through Friday during normal business hours, you can call and they can help you out with using the system or answer most of your benefit questions. I showed you that communications portal. Check that out as well. I think you'll probably find that most of your questions, the answers are housed there. And then, of course, you can always email me, amy.marino@harthanks.com. I do get crazy busy this time of year, so my responses may be a little bit delayed, but I will respond to everyone. Please let me know if you have any questions. This is your enrollment. This is your health care for your family for next year, and we want to make sure we get it right. We've got 3 weeks to do that. I know that we can. Just please reach out to us if you have any questions. I'd rather catch them now. I'd rather do a little legwork, asking any questions, talking to the providers if I need to get you the answers you need before November 11th when we lock that system up and we can't make any changes for next year. So thank you all for listening. I hope you found this informative, and please reach out to either myself or the HR zone if you have any additional questions. Thank you.